Hello, my name is Mary Burns. I'm an instructor for San Diego Community College District. I work out of continuing education, and I also teach classes for OASIS. This presentation, Can You Trust That Website?, is all about trust and reliability. When it comes to healthcare, this can be very important. I do want to begin with the disclosure. The information that I'm providing you with is general and based on recommendations by healthcare experts. Your opinions may differ. What will you learn today? First, we'll learn some steps to find reliable health information on the internet. Then, we'll look at some recommended health information websites. Finally, we'll look at some tips for finding useful health information and how to avoid those sites that are not reliable. First, some steps for finding reliable health information on the internet. You want to first, in step one, look at who is behind the information. You'll see that in About Us. A reputable website will include this About Us section. This section should be written in a clear, authentic, and transparent way. It should include some information about the company and/or the originator of the site. It should include appropriate qualifications and information about the people who contribute to that site. It may include a mission statement or company goal. A reputable health website should have qualified medical professionals behind their site. In addition to About Us, look for other links with names such as our sponsors, privacy policy, or the editorial board. If you can't find out who runs the site, you should be suspicious. The domain name identifies who owns the site. A domain extension is the 3 letters that follow a dot in the domain name. For example, with oasis.net, the site is owned by Oasis, and .net is the domain extension. In some cases, a domain extension may indicate the professional nature of the site. In the past, there were several domain extensions that could be trusted. However, anyone can now get a domain extension of virtually any type except for 2. Sites that end in .gov, these are sites run by the government, and they're pretty reliable. And secondly, .edu sites, those are sites that are run by universities or medical schools. .net and .org may be authentic, but you may have to go further than the domain extension to establish authenticity. Sites ending in .com are often commercial, and they may be selling products. But understand that with over 1,000 domain extensions and no rules using any of the extensions except for .gov or .edu, a site may not be identified as reliable just from the domain extension. A website should make it easy for you to get in touch with the webmaster or the organization that sponsors the website. It should give you a phone number, email address, or other contact information. Step 2, what is the purpose of the site? Consider the reason why the site was created. Look for a goals and mission page. The mission defines the purpose of the business. It should focus on how the site strives to meet those goals. Ask, was this site created to educate and inform? Or was the site designed to encourage you to buy a product for a particular disease or illness? At this point, it's important to be able to separate the facts from the opinions. If a site appears to be based on opinion, it may not be as reliable. Are there a lot of ads on your page? Or is the website maybe one large ad? It may appear as a general website, but may have additional tabs, pages on the site that will lead you to a product. Even if they provide useful information about a health condition, if they're promoting a product, the site may not be reliable. It's possible that the information they include is biased in a way to support their product. You will want to see that the information is backed by science. Beware of sites that rely on testimonials. This may be people who are being paid or somehow are involved in the company and not necessarily speaking entirely truthful. There should be scientific evidence on this health website. Along the same lines, beware if the site is anti-science or anti-government. This is a red flag on the accuracy of the site. Although a government site may have been unreliable at certain times, such as maybe during the initial stages of COVID, you can still assume that their information is accurate, and the purpose of the site is to educate and inform in the best way that they can. Consider the alternative. If a government site cannot be trusted, then which site can be trusted? Step 3. Who wrote it? Who reviewed it? If the person or organization in charge of the site did not write the material, the original source should be clearly identified. Don't trust sites that don't say where the information comes from. There should be information about the medical credentials of the people who prepare or review the material on the website. Even if the author is not a medical professional, the article should pass a review of medical professionals and provide scientific background on their claims. Look to see if the author is affiliated with the website. If they stand to benefit from the exposure, it's possible that that article is biased. You can look to see if the author has published in other publications. Often, an article will link to the biography of the author, so just take a look and see how they stack up. A reputable website should include articles from professionals who are not necessarily affiliated with that website. If the website is owned by a doctor, and that doctor is selling products, and that doctor is writing articles for the website, well, it may not be as trustworthy as an unaffiliated doctor writing for a website. A good health website that is including important studies or research and is not necessarily written by a healthcare provider should at least be reviewed by a healthcare professional. Also, if citing research or a study, the article should include sources that you can visit. They might include links, but if you check them out, you may find that the link is also not from a professional site, or that it might not be saying what the author is saying. Don't just take their word for it. Look up the citations to see what the study is about and see if that matches what the author is suggesting. You should be able to contact the site or the author with questions. If no contact information is given, you can't be exactly sure who the author is. If there's a comment page, you should be able to see the comments. And what type of response has this article had? If the responses come back to personal testimonies about the product in the article, well, again, those comments may not be reliable. Not all websites are factual. Steer clear of testimonial sites, blogs, and social media. These may be biased sources. Step 4, what is the privacy policy? A website will have a privacy policy included. Look for the privacy policy or an all our policies section to see what information about its visitors the website collects and why. Routinely, websites track visitors to determine what pages are used. In addition, some sites may require visitors to subscribe or join. They may even require a fee. They may also allow the website owners to collect personal information about their visitors. Many commercial sites sell aggregate data about its visitors. For example, if you're researching breast cancer, the site might ask you if you have breast cancer. They can then use this information to sell your data to companies which deal with breast cancer. Look for the warning that comes up when you open up the site. Law requires that you're informed before viewing a site if the site will collect data from you, which is known as cookies, and should also say what this data will be used for. If you continue, and you click on continue, understand that they will be using your data. They may also collect information such as your gender, your zip code, and your birthday. If the site is asking for personal information, it should specify what the site will and won't do with the information. So be wary of what you tell these websites, especially in cases where you're dealing with a sensitive health issue. And don't sign up for anything you don't fully understand. If you're signing into a site or providing sensitive information, make sure that site is secure. Look for the HTTPS at the beginning of the web address and a lock. Most sites should not ask for a very sensitive type of data like the Social Security number. Be wary of that unless you're on a site which is going to be delivering health care to you. And only share your Social Security number on secure sites that you are certain are safe and authentic. Don't use public Wi-Fi when entering your personal data. A public Wi-Fi may have a hacker positioned somewhere between you and the website. So in this case, you're sending information to the hacker, and then they're sending it to where it belongs. In that case, the hacker has access to all that information, whether that be a Social Security number, a credit card number, or your medical records. A Wi-Fi which does not require a password is a vulnerable one. Use your cellular connection for sensitive data, or reserve these communications for when you can be on a locked network. Step 5. When was the article written? Websites should be reviewed and updated on a regular basis. Medical information should be current, and the most recent updates should be noted. These dates are usually found on the top or the bottom of the page. If there are a lot of broken links on the page, it may not be up to date. Beware of new studies. It's not that they're deceptive, but they may be preliminary, and they may need additional studies to confirm. Many times a study will be cited as though it's the final word in a popular website. An example of that is a test of masks that was done a few months ago. A study looked at several face masks and found that the neck gaiter, the mask that you wear around your neck so you can then use it to cover your face, was the least effective of those tested. The Washington Post took that study and created a headline, "Wearing a neck gaiter may be worse than no mask at all, researchers find." Turns out this research was not definitive, and this headline was not an accurate depiction of the study. They had to backtrack, but not before it was tweeted and reposted across social media, and as a result, there's a lot of people who believe that neck gaiters are worse than no mask at all. Step 6. Does the website offer a quick and easy solution? Is there a miracle cure mentioned? There's no quick and easy remedy for most illnesses. If the site is suggesting that a remedy will cause a disease, will cure a disease, or that a remedy will cure multiple diseases, it's probably fake. If it sounds too good to be true, it probably is. Be especially cautious about a promise of quick, dramatic, or miraculous claims. Beware of dramatic writing. This product will save your life. Or cures too good to be true. This pill will cure Alzheimer's and restore your memory. Look out for claims that a product will cure a variety of illnesses, products that are considered a breakthrough, or a product that relies on a secret ingredient. Also, be cautious of technical jargon on the website. A consumer-friendly site should have simple language that's easy to understand. Follow up with the topic by comparing that information with other websites. Can you find the same information elsewhere? Can you find the research that you just read about summarized but in a different way? Google that information and then look at some other sites. If this site is claiming something that you can't find on other reputable sites, it can't be trusted. Now, you may see this information on other sites, but then you have to make sure that those sites themselves are legitimate. Sometimes businesses will post multiple accounts of the same inauthentic information. Sometimes you just need to dig deeper to find the truth. And of course, we've already mentioned that you may be on a reputable site with misleading information or misinformation. Understand that health is a constantly evolving topic, and that something that was widely believed in the past may longer be considered true. This is not because the site is trying to be misleading or provide false information, and that's why it's important to double-check your research. Let's look at some recommended health sites. Medline Plus. So Medline Plus is run by the National Library of Medicine and contains a medical encyclopedia and detailed information on medical conditions, prescription drugs, and herbs and supplements. It gives you access to Medline, which has publications and summaries from all the major medical journals published in the English language. The National Institute of Aging. This website offers numerous informative publications and consumer guides, and leads the federal government in conducting and supporting research on aging and health and the well-being of older adults. It publishes information on the nature of aging, the diseases and conditions associated with growing older, and it tries to offer tools to extend the healthy and active years of life. Daily Med. Daily Med provides trustworthy information about marketed drugs. It's that official provider of the FDA label information. The website provides a standard, comprehensive, up-to-date look. You can download the medication content and the labeling from the package inserts directly from this site. It's provided by the National Library of Medicine as a public service and does not accept any advertisements. The Mayo Clinic and Johns Hopkins, they both have websites devoted to health. The Mayo Clinic website is owned by the Mayo Foundation for Medical Education and Research and is funded through donations and grants. It provides information on medical conditions, medications, diseases, and procedures geared towards the lay reader. Most articles include a list of symptoms, diagnoses, and treatments. Johns Hopkins is a legitimate source that uses scientific sourcing. It follows a scientific method, it's unbiased, and it doesn't use emotional words in the context. They use a consensus of experts in the scientific community, and their information is peer-reviewed. The National Institute of Health Office of Dietary Supplements. This is ad-free, scientifically verified information about vitamins and supplements. It was created by the Dietary Supplement Health and Education Act of 1994, and it covers the science behind dietary supplements. Its mission is to strengthen your knowledge and understanding of dietary supplements by evaluating the scientific information, stimulating and supporting research, disseminating those research results, and educating the public. It provides direct citations to peer-reviewed articles. HealthFinder. HealthFinder is one of my favorite health websites. It's run by the U.S. Office of Disease Prevention and Health Promotion and includes an online health library that tells you about treatments for hundreds of different kinds of health conditions. There's links that can help you find a doctor and other health providers depending on your needs. Center for Disease Control and Prevention. This is a consumer-friendly website. It's run by the Federal Center for Disease Control and Prevention and includes information on hundreds of diseases and health conditions, including conditions that are common in different stages of life or for different groups of people. It has health-related information and advice for international travelers. My Medicare Matters. This is sponsored by the National Council of Aging, and it provides a variety of interactive materials on Medicare and provides free one-on-one assistance with selecting and enrolling in health care coverage. Besides that, you can find ways to stay healthy, get tips for drug coverage, and find resources to help pay for medication, and more. There are some tools that you can use to help determine the reliability of that website or article. One of these tools is called Health Web Navigator. This site reviews health-related websites and provides an unbiased look at the site. The goal of the site is to connect with accurate, easy-to-read, and up-to-date health information. It uses a team of medical professionals and usability experts to come up with the sites. The Health Web Navigator uses 50 different reviewers and will assign at least 2 reviewers to every website to corroborate on the ratings. The review takes into account the content of the site as well as the usability. So they use 4 different criteria in the review. First of all, they want to see how easy this website is to use. Next, they want to look at the visual appeal. What does it look like? They'll look at the layout and the way it's put together. They'll look at sites that look like they're professionally designed. They also look at the quality of the site. In this case, they use a tool that was developed by the UK's National Health Service. This questionnaire covers things such as your clear purpose and mission, whether it achieves that purpose and mission, whether the content is relevant to the readers, whether it provides adequate references, whether the content is unbiased and balanced, and whether there are additional sources of support and information. And then finally, they evaluate credibility. This is a way the website discloses who wrote the content, the qualifications of the writer, how current the information is, and any financial motivations of the site. Then, based on this review, the site can be given one of three ratings. Highly recommended, those are scores that rank highly in both content and usability. Recommended, those might be reliable, but maybe not as user-friendly, or it might have a little bit of information that is limited or not up to date. And not recommended, sites containing inaccurate or questionable health content. In this case, the reviewer suggests that the readers avoid the site. The beauty of this site is that you can start with a reputable website and then go to your health topics from there. The websites have already passed the authenticity test. You can search by topic to find the sites which have met their standards. The topics are diverse and include things like diseases and conditions, general health, mental health, senior health, and more. When selecting a topic, you're presented with a list of reputable sites. This is a good way to begin your search for reliable information instead of going on a post from Facebook, which may not be reliable. If you see a post that cites a media source, how do you know if that media source is biased or not? Now, almost all media is biased in a certain way, except for a source like Reuters, which only lists facts. But it nevertheless is helpful to see if the site is biased in a certain way. A small bias isn't a big cause for alarm. You just have to be aware that it has that bias. But a strong bias can lead you in a path that's not accurate. So this site, Media Bias Fact Check, uses a methodology which looks at the facts on the site and then determines whether they're truthful or whether they're biased. The site itself acknowledges that there's really no scientific formula that determines bias. There's objective measures that can be calculated, but much of the information is subjective. After reviewing a website, the reviewers will provide the rating on a scale. It will be an arrow with the yellow dot showing the degree of bias for the source. You can then look at a detailed report to find out how the rating was given. When calculating the bias, they're looking at the political bias, as well as how factual the information is, and whether they supply links to credible, verifiable sources. A particular rating may involve a degree of political bias or factual ranking. In some cases, it might be both. The website also acknowledges that the bias scale is based on the USA political scale, where the Democratic Party is left-center, and that's how they are able to establish the amount of bias in each of these sites. So as an example, the site ranks 3 common news sources in their reading. So first you have CNN, and on the scale, it's on the left, and then you have Fox News, and on the scale, it's on the right. Neither of them are the extreme left or right, and actually they're both nearly identical in where they stand on their side of the scale. Reuters is almost dead in the middle. It's the least biased. The site tells us that 95% of the advertising revenue comes in the form of 2 third-party advertising companies, Google AdSense and Newer Media. They use third-party advertising so that they will not have media influence. They acknowledge that there are cookies that will supply ads to the readers, but they have no control over the ads that you see. Because their revenue is based on these third-party ads, their mission is to provide quality content that will bring people back to the website. Additional sources of revenue include membership fees, which are currently $50 a year, and donations. And donations are limited to individuals on PayPal. Donations from corporations, businesses, foundations, politicians, and political parties are not accepted. So you can use this website to determine how biased and factual your site might be. A quick summary of this presentation. Let's review the steps to determine if a website or health article is reliable. Step 1, look at the sponsor. Who's the sponsor? Look at About Us to see who's behind the site. Look for those additional clues like sponsors, privacy policy, editorial boards, and of course, review the domain name. Step 2, look at the purpose. Is the purpose educational or is it to sell something? Step number 3, who wrote it? Is the author listed? Are they a healthcare provider? Do they have anything financially to gain in writing the article? Was the article reviewed by a healthcare professional? Step 4, privacy. What is the privacy policy? Do they collect your data? What do they do with that data? Step 5, when was it written? Is it up to date? Is it brand new? When was it last updated? And then step 6, does it offer quick and easy solutions and miracle cures? Unfortunately, there's really no quick and easy solutions to most healthcare issues. If it offers one, it might be an unreliable source. Next, we talked about 2 tools that we can use to determine the reliability and truthfulness of the site. So use Health Web Navigator to begin your search on health information using the recommendations provided that are either recommended or highly recommended as ranked by their reviewers. Use Media Bias Fact Check to look for biases and or the accuracy of facts on a particular website. And that concludes the presentation. If you'd like to contact me with questions or comments, I can be reached at maryburns@sdceonline.com. And thanks so much for listening.